Assalamu alaikum. I am Dr. Sagia Afrose, Associate Professor, Department of Pharmacology, Bashundhara Ad-din Medical College. Today I am going to discuss about drugs used in peptic ulcer disease. At first I am going to tell about the classification of drug used in peptic ulcer disease. This category of drugs are divided into 4 groups. Number 1, gastric acid secretion inhibitors, H2 receptor blockers, proton pump inhibitor, anticholinergic drug and prostaglandin analog. The H2 receptor blockers are ranitidine, cimetidine, famotidine, roxetidine, nizatidine, etc. Proton pump inhibitor like omeprazole, esomeprazole, rabeprazole, ransoprazole, pantoprazole, etc. Anticholinergic like pyrangipan, propenthelin and oxyphenonium, and prostaglandin analog misoprostol. Number 2, gastric acid neutralizers or antacids. The drugs are sodium bicarbonate, calcium carbonate, sodium citrate, aluminum hydroxide and magnesium hydroxide. The ulcer protectives are misoprostol, sucralfate, colloidal bismuth subcitrate. And anti-H. pylori drugs are amoxicillin, clarithromycin, tetracycline, metronidazole, tinidazole, etc. Gastric acid secretion has 5 types of phases. The basal nocturnal acid secretion, food stimulated acid secretion, psychic acid secretion, neurogenic acid secretion and gastric acid secretion. The H2 receptor blocker acts by blocking selectively the H2 receptor and block the histamine induced gastric secretion, and all phases of the hydrochloric acid secretion is suppressed like basal, psychic, neurogenic and gastric, and basal nocturnal acid secretion is suppressed more completely. The H2 receptor blocker secretory response is attenuated to all stimuli like histamine, acetylcholine, gastrin, insulin, alcohol and foods, and it prevents the gastric ulceration caused by stress and drug like NSAID, cholinergic drugs and histaminergic drugs. The indications of H2 receptor blockers. The duodenal ulcer, gastric ulcer associated with NSAID, it is less effective than the proton pump inhibitor, and stress ulcer gastritis, Zollinger-Ellison syndrome, gastroesophageal reflux disease and prophylaxis of the aspiration pneumonia. What are the adverse effects for H2 receptor blocker? There is headache, dizziness, bowel upset, dry mouth, rash and CNS toxicities like confusion, hallucination, agitation, etc. Anti-androgenic action like increase prolactin level and inhibit the degradation of the estradiol by liver. In case of male, gynecomastia, impotence, loss of libido, temporary decrease in sperm count, etc. occur, and in case of female, galacturia occur. In case of proton pump inhibitor, it is powerful inhibitor of the gastric acid secretion and it inactivated at neutral pH. The mechanism of action of proton pump inhibitor is at pH less than 5, drug reacts with the sulfhydryl group of the sodium potassium ATPase enzyme that is located on the apical membrane of the parietal cell, and it tight bindly by the covalent bond and inactive it irreversibly and block the proton pump and totally abolish the gastric acid secretion both in resting and food stimulated phase. The indications of proton pump inhibitors are peptic ulcer disease, integral component of the anti-H. pylori therapy and drug of choice for NSAID induced peptic ulcer disease, bleeding peptic ulcer, stress ulcer gastritis, gastroesophageal reflux disease, Zollinger-Ellison syndrome, prophylaxis of the aspiration pneumonia, etc. Adverse effects are nausea, loose stool, abdominal pain, muscle and joint pain, headache, dizziness, rash, leukopenia and hepatic dysfunction. Increased risk of enteric infection in case of proton pump inhibitor and osteoporosis due to lack of calcium absorption and increase risk of hip fracture. Prolonged use of this drug may cause gastric atrophy, intestinal metaplasia and gastric adenocarcinoma. Prostaglandin analog or misoprostol. Prostaglandin E2 and prostaglandin I2 are produced in gastric mucosa and serve a protective role by reducing the gastric acidity, have an ill-defined cytoprotective action. It promotes the mucus secretion and bicarbonate secretion and increase the mucosal blood flow. Modestly, it inhibits the histamine stimulated acid secretion from gastric parietal cell, and prostaglandin inhibit the gastrin release. The protective role it have their ability to cover the gastric and duodenal mucosa and exert their cytoprotective role. The indications of misoprostol: NSAID induced peptic ulcer disease along with the NSAID to prevent the gastric irritation. What are the adverse effects? Adverse effects are diarrhea, abdominal pain. It causes uterine contractions, so contraindicated in case of women with childbearing potential. The antacids, the mechanism of action of antacid is it basic substance and react with the hydrochloric acid and produce salt and water and neutralize the gastric acid, thus it causes pain relief. What are the adverse effects of this drug? Adverse effects are gastric distension due to gas formation, bleaching, metabolic alkalosis, sodium chloride absorption is exacerbated, fluid retention in case of patient with heart failure, hypertension and renal insufficiency. Sucralfate. The properties of sucralfate is basic aluminum salt of sulfate sucrose. It polymerizes at pH less than 4 by cross linking of the molecule and assuming a sticky gel like consistency. How they act? It has no acid neutralizing activity, the ulcer protector, and it delay the gastric emptying, increase the gastric mucosal prostaglandin synthesis. It strongly adheres to the ulcer base, especially in the duodenal ulcer, and it has been seen endoscopically to remain there for 6 hours, and surface protein at ulcer base are precipitated and acts as a physical barrier for preventing acid, pepsin and bile from the coming in contact with the ulcer base. And dietary protein also deposited in this coat forming another layer. This is all for today. Thank you all. Assalamu alaikum.